Hi, in this video we're going to look at the last several criteria of borderline personality disorder which are not found in the DSM-5 but which I think are crucial in identifying the disorder and the functioning of the individual. So the first two are lack of insight and alexithymia. Generally, borderlines have poor insight, little self-awareness, and can identify their problems in only a superficial manner or a concrete way. The reason for this is unclear, though generally people with psychiatric issues find it very challenging to provide clear answers as to why they have mental health problems. The lack of insight and even confusion make it very difficult for borderlines to accept long-term psychiatric family and social supports. Without a modicum of insight, healthy decisions and planning are almost impossible. A related problem for borderlines is alexithymia, which is the inability or difficulty to identify or describe one's emotions, often coupled with concrete thinking and especially bodily sensations connected to emotions. This limits the person's introspection even when his behavior, emotion, and thinking seem somewhat clear to others. For example, the borderline may experience acute anger, though he cannot verbalize why the anger is occurring at the moment, and he cannot explain what triggered the anger from the moment before. This causes the person overt frustration and sometimes results in externalized emotional outbursts. Alexithymia may also limit the person from properly identifying behavior, emotion, and thinking in others, making a proper empathic response difficult and sometimes causing social awkwardness and interpersonal misunderstanding or friction. The combined lack of insight and inability to verbalize or describe emotions often prohibits borderlines from accepting help even from professionals, and this can lead to catastrophic thinking. That's the next issue. Although related to cognitive dysregulation, catastrophic thinking is noted here because it is a core issue with borderline personality disorder and deserves its own consideration. Catastrophic thinking involves ruminating about worst-case outcomes even when there is not sufficient evidence to suggest that catastrophe is at hand, and this can create a self-fulfilling prophecy of doom. It can be a paralyzing issue both in moments of relative calm and certainly in a crisis situation. In catastrophic thinking, the borderline essentially convinces himself of the worst possible outcome by using reason, using every possible negative issue and outcome while neglecting to consider every possible positive issue and outcome. The borderline's thinking can be very narrow, parochial, and even non-inclusive. Catastrophic thinking is often time-specific, occurring in the here and now, because when fears are considered with flexible thinking over many hours or days, the worst-case scenario may indeed be one conclusion, but thoughtful consideration will lead to the possibility of many others as well, including positive outcomes and even survival strategies, making the worst-case scenario untenable. Catastrophic thinking and similar cognitive dysfunction often provoke responses from others so that the borderline can gain a sense of security and validation. The next thing what I want to look at, and it's the last in this series, is provocation and validation. Borderlines often purposely provoke responses through attention-seeking behavior, but also due to unintentional cognitive and behavioral dysfunction that causes other people to respond with bewilderment, anger, caution, frustration, and other reactions. While the borderline is weary of negative reactions from others, fearing that he will fall apart, the provoked feedback also confirms his existence, allowing for a sense of security and validation about his needs and identity, even sometimes confirming that he is alive. So what we've looked at in this set of videos are the criteria of borderline personality disorder that I think are crucial to understanding BPD functioning, which are not found in the DSM-5. And the next series of videos that we're going to be doing will look at ways in which to conceptualize how to help people with borderline personality disorder, how to conceptualize their issues in a way that is more functional and ways that they can assist in their daily lives to find more meaning and contentment and a greater sense of stability and understanding about who they are and their particular issues.